My name is Hugh Reinhoff. I started Imago BioSciences in 2012. I'm a physician, and I've dedicated myself to the study of genetic disease in hematology. And in particular, we're focused at Imago on the myeloproliferative neoplasms, as you know, a set of diseases in which patients acquire mutations that affect the bone marrow. I have personal experience dealing with genetic disease because my third child was born with an extremely rare genetic condition, which took me about 7 years to figure out. I am devoted to developing drugs for the treatment of rare diseases, in particular myelofibrosis and essential thrombocythemia, which is the focus of Imago. Imago is focused on diseases of the bone marrow, and they can range from sickle cell anemia, which is hereditary anemia, or acute myeloid leukemia, which is a much more aggressive disease. And we're focused on all of those diseases, but our current clinical focus is on the myeloproliferative neoplasms that includes myelofibrosis, essential thrombocythemia, and polycythemia vera. We have a clinical trial now we're in the middle of myelofibrosis, and these are patients who have exhausted the clinical benefits of the current drugs that are available for myelofibrosis. And so those patients are in the greatest clinical need for something that can basically improve their daily symptoms, which are really the devastating part of myelofibrosis. As you know, essential thrombocythemia is a disease where the platelets are elevated. And so the risk there is of getting clots, and these can be catastrophic, as you can imagine. And so the idea there is to bring down the number of platelets with this drug, bomedemstat, which it does nicely. You know, I'm sure you're aware of the fact that all three of these diseases are caused by mutations that occur, you know, these are changes in the DNA that occur in the stem cells in the blood. They don't occur elsewhere. And those cells eventually grow and take over the normal cells. So one of the objectives of these studies is to actually reduce that number of cells, which we hope bomedemstat will do. So we're really focused on two things. One is improving the patient experience, the symptoms that patients experience on a day-to-day basis, but also the long-term outcome. Bomedemstat is the first drug that targets an enzyme called lysine-specific demethylase, or what we call LSD1, to be used for the treatment of myeloproliferative neoplasms. And we're using it initially for the treatment of myelofibrosis, and these would be in patients who no longer benefit clinically from the standard of care, which is ruxolitinib, or otherwise known as Jakafi. And that's where bomedemstat comes in today. And we've enrolled patients who are in that state, and we're getting good results. And these results have been presented at various hematologic meetings in Europe and here in the United States last year and this year. And the study continues to expand and enroll patients with a view towards approval as soon as possible. And the European Medicine Agency has recognized the potential of bomedemstat by granting it what you might call provisional breakthrough status, that if it fulfills its promise of being a better tolerated drug for the treatment of patients who have failed the clinical benefits of ruxolitinib, that they will expedite approval of this drug. Myelofibrosis is a rare disease, and there are many different theories on how to improve the outcomes, and that requires the participation of patients who have the condition. Clinical trials require the participation of willing volunteers to come into these studies, and we're extremely grateful for those patients who decide to give bomedemstat or really any other experimental treatment a shot, because it improves our knowledge and understanding of these medicines, and also it helps focus on what's important about the patient experience. A patient may not care about certain kinds of symptoms, but really care a lot about something like fatigue, for example, which can have a devastating effect on the daily activities. So we are grateful that patients enroll, and there is a need for more patients to participate in these studies. So you might ask how you can learn more about bomedemstat and what Imago is doing in the MPNs. And the first step would be to go to our website, which is imagobio.com, imagobio.com. Or if you're interested in myelofibrosis, go to another website called Myelofibrosis Clinical Study, all one word, .com. And there, information about our trial and information about bomedemstat can be available. I want to give a shout out to the MPN A&E International, the importance of their work and the importance of advocacy among patients. And I'm very thankful to you patients who are listening to this and interested in participating in these studies, and certainly making other patients aware of therapeutic options, clinical trials, et cetera. It's without patient participation and without advocacy groups to organize those patients and inform those patients, these studies really could not happen.